5, we will be learning about pneumonia and the most common associations and buzzwords. So, first is Streptococcus pneumonia. With Streptococcus, you need to remember herpes labialis, a cold sore present on your lip, lower lip. Staphylococcus, one of the most important association is it occurs after influenza. Any elderly who has been having a cold for 2 to 3 days, and after that he suddenly deteriorates and a pneumonia-like picture is seen, and that would be staphylococcus. And on chest X-ray, it would most likely be bilateral cavitation. Staphylococcus pneumonia is a cause of bilateral cavitating lesions, which you can clearly see on the chest X-ray. Coming up next is mycoplasma. It is associated with erythema multiforme. So you can remember it as M and M. And erythema, it's red, right? Erythema multiforme, target-like lesion. Erythema means red. Remember it with red cell agglutination. So for red cell agglutination, the hint that they might give you in the exam would most likely be, they would either say directly that it is associated with red cell agglutination, or they may state that there are cold agglutinins seen in the picture, or there would be any signs of hemolysis like raised LDH. Coming up next, Klebsiella. It is also a cause of cavitatory pneumonia, and it is commonly seen in alcoholics. Legionella, we all know Legionnaire's disease, traveler's pneumonia. It is most commonly associated with hyponatremia and lymphocytosis on the blood picture. Coming to treatment, Staphylococcus pneumonia and Streptococcus. These two are the typical pneumonias. Rest of those, they are atypical. Mycoplasma, Klebsiella, Legionella. So whenever you see atypical pneumonia, you need to remember that the first line treatment for atypical pneumonia is clarithromycin. And in case it is contraindicated, like a patient who is already taking statins, we can't give both of them together because then we have a risk of rhabdomyolysis. So if it is contraindicated, you can give doxycycline. And for staphylococcal pneumonia, everywhere staphylococcus, we have the treatment with flucloxacillin. Even in cellulitis, it's most commonly staphylococcal cellulitis, you give flucloxacillin first. So these are the most common associations with pneumonia.